Now, while COVID-19 case levels remain high, there are signs of hope, with Dr. Anthony Fauci pointing to Omicron cases peaking and now declining sharply in the Northeast and upper Midwest, saying things look like they are, quote, going in the right direction right now. But of course, we've got that highly transmissible Omicron variant, and we've seen pandemic high hospitalization rates among children. So joining us now to discuss how children continue to be affected, the chief medical officer over at the Dayton Children's Hospital in Ohio, Dr. Adam Mezoff. Thank you so much for joining us.
Thank you for having me.
Absolutely. Listen, what are the latest COVID-19 numbers that you're seeing at your hospitals? Are you also seeing more cases than before the Omicron surge?
We absolutely are. For comparison, in the end of December, 1 out of every 30 patients we'd admit to the hospital had the Omicron variant. Now it's 1 out of every 5. So the numbers went from about 4 or 5 patients in the hospital to between 20 and 30 patients in the hospital.
Wow. Okay. So that is quite a big increase there. And doctor, of course, I don't need to tell you, vaccines, they're only approved for children 5 and up. But what percentage of the children at your hospital are unvaccinated?
About 98% of the children admitted to our hospital with COVID are unvaccinated.
Okay, so that is a big number now. And, we hear a lot about possible long-term side effects for those who have had COVID. But what about children? Are you seeing those long-term side effects there, too?
We're fortunate that there are fewer long-term side effects for children. However, roughly 10 to 15% of children will have what people refer to as long COVID.
And doctor, I know that you were also telling us that parents they have those unvaccinated children in the hospital, they're actually changing their mind when they're actually there in the hospital and they see what COVID has done.
You're absolutely correct. In fact, many are asking that before they leave the hospital that they get vaccinated because they've seen the effects of COVID.
Yeah, I think you said that they won't even leave until they are vaccinated, that their children have been vaccinated. Dr. Fauci told ABC's This Week yesterday that he believes that most states will reach a peak in Omicron cases by mid-February based on what you're seeing with this variant. Are you also hopeful that we're on the way to this becoming endemic, or are you worried about another variant?
Based on what we're seeing, we are hopeful that in the early part of February, we'll have peaked through this surge and hopefully be on the other side of it. As far as whether or not another variant may take its place, I am hopeful that doesn't happen for a lot of reasons. So we share the optimism that hopefully this is one of the last parts of the pandemic part of this, and we head into the endemic part of this.
Oh, and we are all hopeful for that as well, doctor. And finally, your staff at Dayton Children's Hospital, they've been working so hard. Talk a little about the emotional and physical toll that this pandemic has had on them. How are they doing?
Thank you for asking that question. We have an amazing staff here, whether it's the nurses, the doctors, the folks who are cleaning the rooms, the respiratory therapists. They have gone way above and beyond what normally folks have done in their jobs because of all the illness. And understand that, especially at our hospital, because a lot of our staff have young children. If their young children are out and sick, they have to not come to work, even if they are not sick, because they have to take care of their children. So with those staffing shortages, people have stepped up, done countless extra hours, covered for their friends. But this is going on 2 years now, so everyone is getting tired. And we hope that the community can embrace this by saying, let's all get vaccinated so we can all get out of this together.
I'm so glad that you mentioned the staffing shortages because we're seeing that in businesses all across this country. Are you still seeing that at your hospital?
Absolutely. Many people at the beginning of the pandemic decided that for health reasons in particular, that it wouldn't be safe for them to continue to work in a hospital. So throughout the course of this, with all the challenges, we continue to see staffing issues and people having to step up extra hours multiple times to make sure that the kids get the care they need.
All right, doctor, it is such a pleasure to have you here. Chief Medical Officer for Dayton Children's Hospital, Dr. Adam Mezoff. Thank you so much for joining us.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.